Vikram, last time when we spoke 5 months back, you mentioned the experience was about 3-4 months with this virus, and you mentioned about the ugly face of COVID in US. The virus shouldn't be trifled with, and the data and the evidence was limited. So if I may ask you generally, with respect to the state of affairs today, and very fair that you are based out of the US, so we'll get a sense of what the state of affairs in US is, but generally and broadly, what do you think the recovery rates look like now? Maybe we can start with that, and then I have a few more.
Sure. Thanks, Rich. So again, thank you everyone for joining. I think I'll start off by saying that, this is a once in a century pandemic. The last time the world saw something of this level is back in 1918, 1919 with the Spanish influenza, which killed millions of people and affected millions and millions of other, made a lot of other people sick. Now, we have to learn a lot from the experience there, just because we should recognize that in the 1918-19 influenza, the second wave killed 5 or 6 times more people than the first wave. And not recognizing that will be a little bit of ignorance on our part, because as you know, history repeats itself, and we should recognize that even though the first wave in most parts of the world has come and gone, the second wave, the US is in the middle of the second wave right now. And as you can see, back in the spring, it was parts of the US that were affected, the Northeast, New York, Chicago, New York, Boston. But right now, the entire Midwest, parts of Minnesota, the entire middle of the country is essentially is burning. Many parts of the country in the US have no ICU beds left, and it's a shame because it's been politicized, where being a mask wearer makes you lean politically and so forth. And a lot of these deaths, in my mind, could have been prevented with following signs. Now, the situation in India is also concerning, no question. We can see, though, that the numbers in India are not as roaringly high as they are in the US, but a lot of that might have to do with the level of testing that is also going on. We should recognize that winter, especially in the US, is coming, and this virus will take a huge impact on lives as the winter comes in. So by no means has this gone away. In fact, the thinking is that it will remain in the community for many, many years to come, but the way we get affected by it once a vaccine comes out and is deployed will be in a much more moderate form than before a vaccine comes out.
And I can add to that, Vikram, speaking with friends in Europe and other jurisdictions, whether it is Sweden, Norway, UK, Germany, France, Italy, Spain, just about everybody is going through a second wave. This week, they went into lockdown, and the restrictions are as severe, and maybe in some cases more severe than the first time. So, may I ask, what are the reasons for a second wave, and is there something like a third wave?
Yeah, that's a great question, Jeet. So, essentially, we know there are a lot of things we know now since May. One is that this virus is very infectious. It transmits from one person to another person very easily, more than the flu, more than most other respiratory viruses. The other thing that makes this virus really difficult to control is that you have a fair number, up to 33% of patients who have the virus in their lungs and their respiratory tract with no symptoms whatsoever. So this makes infection control really difficult, because if someone has a fever and a cough, yes, you can isolate that person, quarantine that person. But in this case, 1 out of 3 patients will have no symptoms whatsoever, yet will transmit. Well, that makes it a really catch-22, where you really cannot identify a patient who has the virus easily. So the reason the second wave is being seen in many parts of Europe is because many parts of Europe and the US have ended their lockdown, and that had to be done because of the huge financial and economic toll that the lockdown was taking place. But as the lockdown ended and people came together, became more social with each other, went to schools and colleges, went to work back again, went to bars and restaurants and stadiums, the virus is still there in the community. There is no herd immunity. So it's really not a surprise that cases have gone up again. And in my opinion, this is going to happen again and again till a vaccine is developed and deployed. That as there's another lockdown in many parts of Europe, as the virus numbers come down, the economy will start opening up again. As the virus goes up again, the economy will close again, and this will be back and forth till we have herd immunity, which is a far, far way to come.
And I have questions on both the points that you raised, the economy opening up, herd immunity, and a few other things. But before that, you mentioned about the cold weather. Is there a linkage between COVID? I mean, influenza, yes, I appreciate and I understand, but is there a linkage between COVID and the cold weather? Because I read some studies which seem to suggest the weather has absolutely no effect on the incidence of COVID. So your thought?
Yes, so a few things play into that. One is, especially in temperate climates, people who live on top of the certain latitude, it's cold, it's snowing outside, many people congregate indoors. And if you don't have ventilation good ventilation inside your apartments, inside your flats, inside your restaurants, the COVID particles can persist in the air for a much longer duration and therefore transmit much easily. That's one. The second reason why winter is always going to be precarious is because the virus itself lives longer on surfaces in winter than in summer. And thirdly, influenza historically affects more people in the winters. And if you have your ICU beds and your hospital beds completely inundated with influenza patients, that reduces the capacity to take care of patients with COVID on top of that. So yes, most places in winter will see a much poorer outcomes.
Okay, so let me flip this and ask you, do you feel that during the summer months, the incidence of COVID was lesser?
Yes.
Okay.
I mean, the drop that we saw in summer was because people were outdoors, not very close to each other. There was good ventilation outdoors, but all those things, all those protective factors will go away in the few months to come.
Fair enough. I just have one question before I move to the next bucket. And, we are still debating in India whether we've had the second wave, whether we'll ever get the second wave. And when I had the epidemiologist Ramanan speaking on the show last time, he mentioned that he predicted actually, that probably we won't have a second wave, and the first wave and the second wave will combine. And that's when you'll see a peak and it'll go down. So I take your point about testing and how many are being tested, but cases are going down from 100,000 to 70, 65, 60. So what is your view about India second wave, whether we'll have it, we've had it? I mean, I won't hold you because you're practicing in New York, but just broad thoughts.
Yeah, no, those are good questions, and I follow the India data very closely as well. One is the mortality numbers in India are reassuringly low compared to the US and parts of Europe. One of the reasons behind that is because India, as you know, has a much younger population compared to many European and American countries, and advanced age is a big risk factor for poor outcomes. And by poor outcomes, I mean ICU admission, being on the ventilator, death. And one of the reasons why I think India has a lower mortality is because we have a younger population compared to the US. The second thing I have a bit of concern is that the testing needs to be done in the rural areas, in the villages and the towns, which are not as well equipped as the big cities like Bombay, Calcutta, Delhi. And I have a little bit of a concern of how deep we can go by testing. I know we're testing close to 1 million people a day in India, which is amazing. But for a country of 1.3, 1.4 billion, there is a space to further deepen testing. And unless you are testing a fair number of your community, getting reliable numbers, which are important for source control, are very difficult, especially because contact tracing is going to be very key. So if you test me, if I'm positive, you need to test my wife, my kids, my immediate surroundings, and then isolate them if they're positive. And that would be the one way to go to get a control of this.